to know, though you have said something like that about the scope of, is it just in the primary healthcare center that we see this community physiotherapist, or do we have other centers where we can see them? I mean, I would like you to let us know about the scope or the areas of practice where we can see this group of physiotherapists.
So when you say scope, I would like to say that the scope is very broad.
Okay.
The services of a community physiotherapist is very broad. It's just like saying a family physician, they see all kinds of cases.
Right.
They are not restricted to, neurophysiotherapists see only neuro cases, orthopedics, they see whether there are neuro cases, there are orthopedic cases, there are cardio cases, as long as these are physiotherapy conditions or conditions that require physiotherapy that reside in the communities. The community physiotherapist sees them all. They are equipped to see them all. However, because we encourage specialization in physiotherapy, if there is a case that a community physiotherapist cannot handle, it's beyond their knowledge or their practice, of course they can bring in a specialist in that area. Because they are working in the primary health care. They are working in the primary health care. They can bring in specialists from the general hospital or tertiary to see the cases that are more complicated than they can handle. So you can see that the work of the physiotherapist needs a lot of skills. It's not for neophytes.
Yeah, it's not for neophytes, that's the word. I believe, and again, when we come to the communities, it's not just the primary healthcare center. I know we have police barracks, military barracks. Most of them are, some of them, not all of them, are being, built in the communities. Do we have physiotherapists working in those facilities?
Well, that is a $1 million question, if I may say, because why are we even leading this advocacy? We are leading this advocacy because we don't have enough physiotherapists even in the primary healthcare centers. So now you're talking about having them in institutions like the police and all of that.
Military.
They are supposed to be in those places. Of course, they are not limited. They're supposed to render services in those places. But do we have enough? That is not the question I'm sure that's not the question you're asking me right now. But of course,
do we have enough?
No, we don't have enough.
We don't have enough physiotherapists. So what are we doing to have enough?
Okay, now that is where government comes in. We are leading this advocacy and we're saying that there is the need to train and improve the manpower. Broadly speaking, not just for physiotherapy, broadly speaking, we have suffered in recent times the brain drain that a lot of the physiotherapists who were even rendering services in the urban centers have left, let alone the remote locations. So we are calling on government to improve the manpower that we have. And how will they do this? Let's have more of our people enroll to study physiotherapy. And when they study, let them also be equipped with with facilities and competencies to not just work in the urban center, but also provide these services in the remote location. It's easy enough. With the growing population, we have more people going into the university. So why are they not doing these courses? All we need is to train people, train them adequately, and they will have the manpower to deliver the services.
Okay, that's right. I believe what we are saying is that to increase the manpower, increase the number of
the quota
for institutions to take in students to study physiotherapy without lowering the standards. I know the emphasis should be on the standards should still be maintained.
We have already said that the minimum standard is the doctor of physiotherapy. Anything less than that, then it is not physiotherapy.
It's not physiotherapy because of the essential nature of the services the physiotherapists render. And then again, is a profession. I believe it's a profession that requires a lot of skills.
Of course.
So we are seriously advocating for the highest qualification possible for physiotherapists, because you don't give what you don't have.
Of course.
Nemo quod non habient. You don't give what you don't have. So if you're well equipped and you have the best of qualification, you can fit into the community and deliver.
That's right.
And that will help to provide, the best of care to our people in this community.